diarrhea remains a major cause of child morbidity and mortality in low and middle-income countries, accounting for 1.7 billion cases with a 500,000 annual death in under 5 children. In Indonesia, the Ministry of Health reported that the prevalence of diarrhea among children under 5 years of age was 17%, accounting for around 4 million cases in 2018. Rotavirus vaccines are highly effective in reducing the burden of diarrhea in infant and young children. However, Indonesia has not yet introduced a rotavirus vaccines into the National Immunization Program, and the high cost of available commercial rotavirus vaccines have limited the widespread use. To analyze the cost-effectiveness of rotavirus vaccines being introduced into the National Immunization Program, we need to estimate the direct and indirect cost of diarrhea illness in Indonesia and for specific types of healthcare facilities, regions, and payment types. For direct medical cost estimation, we collected information from patient medical and billing record of 1,050 hospitalized under 5 children with diarrhea across 45 health facilities in 7 provinces from 5 different Indonesian BPJS regions between 2017 to 2020. To estimate the direct non-medical costs and indirect costs, we interviewed 240 caregivers of inpatient from the respective area. Based on study result, acute diarrhea predominantly occurred in younger children with an average of 19.7 months. 59% of patients paid their medical expense from the Indonesian National Health Insurance Program or JKN, 39% paid from out-of-pocket, and 1% from private insurance. The weighted average direct medical cost for treatment of diarrhea as an inpatient across health facility types was $99.8, consisting of 35% room costs, 29% professional fee, 26% medication costs, and 10% diagnosis costs. While the weighted average for outpatient was $7.6, consisting of 34% diagnostic costs, 28% medication costs, 27% professional fee, and 10% registration fee. The average direct non-medical household cost was $4.9, and the indirect cost was $9.9. Among provinces outside Java Island, South Kalimantan demonstrated the highest unweighted average cost, while the lowest cost was reported in Bangka Belitung Island. For outpatient care, the highest unweighted average cost was documented in South Kalimantan and the lowest reported in Central Java. The weighted average direct medical cost per case of non-hospitalized diarrhea across all health facility types was about $7.6. The highest average direct medical cost was estimated in a private hospital, around $24.6. Direct non-medical cost of $1.29 million, and indirect medical costs of $2.16 million. Based on this study, the total direct medical cost for inpatient case was 1.3 times higher in a private hospital than in a public hospital. For patients treated in the outpatient settings, the average direct medical cost was estimated at $3 per visit. Acute diarrhea caused considerable economic burden on households, particularly in hospitalized patients paying their costs from out-of-pocket method. From the social perspective, the study highlights that acute diarrhea presents a considerable economic burden with costs of over $30 million per year for hospitalization-related costs alone. Rotavirus is the most common cause of severe diarrhea in under 5 children. The introduction of a rotavirus vaccines into the National Immunization Program in Indonesia has the potential to reduce the diarrheal disease and the economic burden of acute diarrhea. In conclusion, there is a significant economic burden associated with acute diarrhea in children in Indonesia. This study, based on a wide variety of healthcare settings and geographical regions, provides data to inform the economic evaluations of rotavirus vaccines and other diarrheal prevention programs. This data will be used to estimate potential healthcare cost savings within future cost-effectiveness analysis of programs aimed at preventing and treating acute diarrhea in children, including the implementations of vaccines such as the rotavirus vaccine.